now go on to our next speaker, Dr. Dharmendra Nath, who's again a very leading eye specialist in Agra, one of the pioneers in cataract surgery from Agra Eye Center. And he is going to be showing us a new instrument by which he does phaco in a pretty unique manner. On to you, Dr. Dharmendra Nath.
Thank you so much. Is it there now?
Yeah, you have started sharing. Yes, yes, yes.
Yes, thank you so much, madam. And definitely so many thanks to Dr. Mohan Rajan. And he visited my place once about 2 years back. So this is the new technique of the aligned chopping in phaco. Actually, why this idea came in my mind, because most of the time, what happens, the nucleus spins. Okay, I just want to share, then I go to the slide share now. Then, so what happens, you just see when you want to chop this hard nuclei, especially, they start spinning. And most of the time, I mean, you get a real trauma to the capsule and the what you have made the CCC. So once again, just see this, trying again, and chopper is applied to the periphery and try to chop it. Though it chops, but it spins more. The edges are not so clean cut, but it is. Are you listening?
Dharmendra Nath, we are not, your video is not.
Video is not playing, sir.
Oh.
Video is not playing.
Okay.
So
can you stop sharing and share again?
Okay.
Open the video.
I'm just opening. My video is.
हाँ, आपके में रन कर रहा होगा.
हाँ.
अभी आप.
अब आया?
अभी आप देख रहे हैं. We can see you.
No, आपका video नहीं आया. That time you played, no?
You open the video.
Wait. Just going.
First minify.
Now.
First minify. This zoom.
Now this is it okay now?
No, we can't. Doctor, first open your presentation, then come back to the Zoom window and then share screen.
Okay, I just try once again. Now I am.
Mr. Sunil, can we share his video? It's a good video which he's showing.
Yeah, let me just share it from my end.
Yes. Dr. Dharmendra Nath, stop sharing. Let Mr. Sunil share your video.
Okay.
You can talk along with it. Yes.
Is it there?
Yes, it's there.
Yes. So most of the time, actually, what happens that nucleus start spinning. So for that sake, what we have done is the big CCC is there, and the central, from the paracentral area to central, there a crater is made, and from the side about 30 degree away from the main port, the aligned chopper is introduced inside, and we just go to the high vacuum and very low pulse phaco, very little, and go to the periphery, chop it, and it clean cut. There is a clean cut. I mean, one hand is stable and another hand is splitting the whole of the nucleus in the half hemisphere. And again, you just rotate the nucleus, and the left hand, this chopper also facilitate in rotation also. And again, it chops from the periphery. It gives less stress. And see this case also, this is the hard cataract, and we are just holding the one half of the nucleus and chopping it from the periphery. And this is again, rotate the nucleus with the same instrument. It is angled chopper about 30 degrees from the main shaft, and go to the periphery, chop it. And it gives a clean cut chop without doing any stress to the jonules and without damaging to the anterior and the posterior capsule. So again, hold it and chop it. This is how we just do it. Again, rotate it. It facilitates in rotation of the hard nucleus also, because it is angled. Go to the periphery. Again, hold it and chop. This is how you can do the multiple pieces, and after doing the multiple 4 pieces, or you can chop into the 8 pieces or whatever you. So this angle chopper is definitely is added advantage in chopping the hard nuclei. Soft nuclei you can take it with any of the chopper, but hard nuclei is difficult to deal with this. Regular choppers. Now, do you have the another? This is how we are doing the multiple chops. Now, see this. This is the from your side, and hold the nucleus in the center of them doing the good CCC in the center, and you see the aligned chopper. The force is towards the tip, not towards the other side. Just hold the nuclei, and this is the sharp chopper. And this is how we just separate it, giving the less stress to the jonules. So this is my basic aim and idea is just to facilitate and make easy chopping and nothing else. So that's why the name the aligned chopping is giving, because the force is towards the tip, not towards the outside. So most of the chopping technique is not like that we are chopping outwardly, not to the centrally. So this is towards the tip.
Wonderful videos rather. Could you describe your chopper length and dimension?
Yes. This is actually regular chopper, which is about 30-degree bend, about 2 millimeters away from the tip. That's it.
You said
from
it's
the
a
2
sharp
millimeters
chopper.
away from. Yes, Rajan.
Sir, you said it's a sharp chopper.
Yes, sharp chopper is for the vertical chopping, and the blunt for the peripheral chopper.
That's what, because if it's a sharp chopper, you cannot use it for horizontal chopping.
Yeah.
Yes. That's what I told you. This is for the vertical chop, and the horizontal chop is a blunt one.
Okay.
And that is, yes.
It's a little longer, no? The tip of the chopper.
It is about 1.5 millimeter long.
Oh, only 1.5. Okay.
No, well,
Yes.
the only problem I envisage is that
Yes.
because when you have a very brown cataracts, there is
Yes.
nucleus and more nucleus, and there is no
Yes.
cortical cushion.
Yeah.
Okay,
Yes.
the entire bag is filled up with the nucleus.
Yes.
And then when you do, that's why I prefer a vertical chop in these patients. Okay, if you do a horizontal chop, you need to make a rexus little bigger and then go from the periphery.
Periphery to the
Yeah.
center.
The problem is when you go underneath the rexus and come from the equator, which is you are doing in this aligned chopping with this blunt chopper, then there's a possibility. I'm just telling a possibility. You're a good surgeon. For an average surgeon, there's a possibility you can damage the zonules, even the PC, because there's a little blind technique going underneath and coming out. If there's a cortical cushion, no problem at all. If there's no cortical cushion in the very brown cataract, you may have some problem. I prefer vertical chopping for these patients.
I missed telling you, because in the hard cataract, because we are holding the nucleus with a high vacuum, so we just when we are doing the chopping, we just increase the bottle height just to have a more space in the anterior chamber.
Okay.
At that time,
I want to make one comment.
No. Okay.
Yes.
We have many more surgeons
Yeah.
to operate. Make it brief. I just realized that it's already 7:50. Yeah. So, would you want to add something? Shall I go on?
Just 30 seconds. You see, Dr. Mohan and Dr. Dharmendra, both are my very good friends. You see, when we do the radial part of the chop, we actually don't divide. It's only when we do lateral separation, the nucleus gets cracked. That is one thing which I have found that phaco surgeons have not realized so far.
But in this chopping, what we do, we just hold it and we chop it from the periphery to the tip of the phaco. So this is the exact thing of doing the chop.
Yes.
So that is exactly the point. When you are bringing, actually you are not dividing.
Yes. No. That's what I say. From the periphery to the center, we are actually chopping it. You just see the clean cut margin of the pieces.
I think fine.
We shall now.
आपका बहुत अच्छा डिवाइस है डॉक्टर साहब, हमने यूज किया हुआ है, बहुत ही बढ़िया है. It's fantastic.
We shall now